Hello, and thank you everyone for joining us for this Inner Source webinar series. I'm excited to introduce Dr. Dawn Siglain. I'm Dr. Kochko of Inner Source, if you haven't met me yet. Dr. Dawn Siglain is a naturopathic doctor who believes in the body's innate ability to heal itself when treated with nature and understanding. She's also a licensed acupuncturist and Reiki practitioner. She received her doctoral degree in naturopathic medicine and Masters of Science in Acupuncture at the University of Bridgeport. Combining both Western and Eastern modalities allows an opportunity to address patients' needs in their own specific way. Dr. Dawn specializes in autoimmune, pulmonary, and renal conditions. Today's topic of food as medicine is particularly special to her because it is the foundation of the medicine she loves and was also a key player in optimizing her own health. It's her mission to empower others. Without further ado, Dr. Dawn Siglain.
Hi guys. Thanks so much for joining today. I'm excited to share this information about food as medicine because it is particularly important to me because it did help me reverse a couple chronic conditions that I had, and without naturopathic medicine, I wouldn't be in the great health that I'm in today. So I'm very grateful to it. And food was a major component that I used, having proper nutrition, getting the nutrition and nutrients from my food, as well as avoiding certain foods that were actually playing a part in my chronic illness. So chronic illness can really come on slowly, and it could be constant, and sometimes people just get used to the way that they're feeling. But I'm here to share some information to empower you guys to know that you can use food to really make yourself feel better if there is something going on, or just optimizing your health in general. If there are any deficiencies, you can get them from food. So it's really important. So we'll get started. Okay. Hang on 1 second. Okay, here we go. So basically in the introduction, everything was there. So I'm a naturopathic doctor. I also have my master's in acupuncture. I love to also practice Reiki with energetic healing with the chakras. And I have a lot of training in personal training. So that helps moving the body, we call in Chinese medicine qi stagnation. So getting the body moving, getting those muscles moving really does help the overall picture for a lot of people. And also working as a health coach. So that's kind of how I started on this journey. Okay. I think that I just have a little delay here with each of the slides. So just bear with me here. 1 second. Okay, I think I figured it out. So Hippocrates said it best, so let food be thy medicine and medicine be thy food. So really popular saying, and really resonates with what I'll be talking about today. So you always hear you are what you eat, and I'm going to reinforce that today in this webinar. And also you think what you drink. It's important how much water you're drinking, what you're consuming in liquids, how you react to caffeine, and how that can also affect your thought process. So what you're consuming in all forms, nutrition can come in food as well as liquids. So it's important to remember that. And nutrition is, so I love this quote here, is a study of how a living organism, us humans, ingests, digests, absorbs, transports, utilizes, and excretes food substances which are necessary for the survival of the organism. So with my patients, I'm always asking them, you know, how, with their review of systems, top to bottom in their body, how everything's functioning and how they're feeling, because it really can clue me into if digestion could be a factor, and maybe if we can use some foods to help things along. Okay, so management of disease. When you eat the best you can, you really can feel the best you can. So it is possible with the use of food. So if there's one thing that everyone takes with them today from this webinar, is that eating the food that's nutritious for you, and in naturopathic medicine, it's all about personalized medicine. So what food might be beneficial for your friends could be not as good for you. So sometimes this gets confusing. People say, oh, but my friends can eat all of it. My family eats all of it. This is what we eat for Sunday dinners. How could this certain food be bad for me? It depends on each person. So if there is a chronic condition, you can reverse it with food. And sometimes you can go back to maybe eating the foods that put you in that state, but when you treat the body, give it what it needs, and you reverse the chronic condition, then you can sometimes go back to eating the food. So it really does depend on the person. And then Hippocrates says another wonderful phrase: leave your drugs in the chemist's pot if you can cure the patient with food. So really, really powerful. And is there one good diet for everyone? So that's what I was just talking about. Every single person has a unique biological makeup. So with genetics, food can actually turn on or off these genes. So you might have a genetic predisposition for a particular disease, but you can keep that at bay by eating the right foods. Oftentimes genetics gives us a lot of information, but instead of getting down about it, it's empowering to know if you are predisposed to something, and then even reinforcing it more to make the proper food choices. So knowledge can be empowering. It can really bring your health to the next level. So something to think about. And then epigenetics is all the other stuff that we can control. Well, except for our prenatal nutrition. So what mom was doing and taking care of herself when we were in the womb, that's part of it. The nutrition, what you're eating every day, environment, there's certain toxins that are in our environment that affects us. Our lifestyle, if we're exercising and moving, a sedentary lifestyle can have really negative impacts on your health. And stress, how you're handling stress, how that affects you. We all have stress, but how is it settling in your body, and is that a factor? That's all epigenetics, those extra things besides the genetics that we're born with that affects health. And nutrition is one of those main factors, so it's really important. Naturopathic wellness plan, this is what I do. This is what naturopathic doctors do. We treat nutrition. That's the first and foremost. Lifestyle changes and supplements based on deficiencies. I'm really conservative with my supplements. Whether someone's presenting with a deficiency, or it's showing up, and then that's the way to supplement. You don't want to over supplement, because then you can cause more damage than good to the body. So less is more when it comes to supplements, and having someone who has knowledge about supplements providing them for you. So definitely have a good practitioner looking at that for you. So some basic tips. So I hope you guys enjoy my picture there. I love to make food fun. So actually I made this for my sister-in-law's baby shower. It's a little train crudité there. So you can have fun with your food. So that's peppers, some cucumbers, some blueberries on there. And especially for kids, events. So you don't have to necessarily go to the bakery and get some cookies. You can actually, make a lot of things with food. So the point of that picture is that minimally processed fresh food is the best for you. You get tons of fiber, and it's better fuel for you. It's actual food, so the body knows what to do with it and how to synthesize it and what the body needs to use from it to function, as opposed to processed food where the body has to think about what is this foreign body that looks like food and tastes great, but it's in this package and then I don't know what to do with it. So raw is optimal, but I have to bring attention to the fact that if you have digestive foods, raw food can pose an issue. I can talk about this in another webinar if you guys are interested. So the stomach is an acidic environment, and so the stomach requires that fire, that heat. You want a heating environment there. If you eat a lot of raw foods and then have digestive issues, so digestive issues can be constipation, diarrhea, gas, bloating, things like that. And you kind of just get that feeling. Perhaps it's after food. Think about that. Ask yourself, am I having lots of salads? Am I having lots of smoothies? Do I have lots of iced teas, iced coffees, ice cream? If you're having a lot of those foods, then you could be cooling off that digestive fire. And that prevents food from getting absorbed and allowing the stomach to function the way that it needs to, producing acids to break down foods. You're limiting your stomach as to what it can and should do. So consider heating for healing if that's the issue. Lightly steamed, sauteed foods, Soups and stews can be really healing. Some really good broths can be very healing for the gut. So something to think about. Happy to talk about that more. So questions to ask yourself how you feel after eating, and think about you can ask yourself if you're eating the foods that are right for you, or if you're preparing them the way that your body needs to. So do you feel energized or sleepy after food? If you're feeling energized, that's great. That's the way that you should be feeling. If you're feeling really tired and sleepy, maybe that's not the best food for you. It could be, perhaps it's a processed carbs and you're spiking and then your sugar's dropping. Do you have any digestive issues like what I was just talking about, gas and bloating, particularly after food, or just in general? If you have that, think about your digestive tract and if you need a little support there, and ask yourself, is there something a choice that you're making that could be playing a role? Do you feel abdominal pain or general pain? Again, you want to make sure you have a good practitioner looking after you. If you have any sort of pain, definitely you want to know why you're having that pain. Digestive issues, the food that you're eating could be playing a role, or it could be something more serious and you need to look into that, but could be related to the food you're eating. Do you feel warm or hot after eating food? Could be a sign that you're reacting to food, and that food is causing you to have an inflammatory condition possibly. So something to pay attention to. Do you experience brain fog, especially after a meal? You should have more energy. You should be able to focus. That brain should be fueling you, getting into your cells and giving you the nutrition you need, and you should be able to think clearly. So when it comes to gut health, you want to think about probiotics and prebiotics. So I get asked this question a lot. What's a prebiotic? People are often talking about probiotics. Probiotics are those different strains of bacteria that are beneficial for your gut. So think of fermented foods, sauerkraut, pickled foods, even there's kombucha. Those do tend to have a lot of sugar in it. So if that's an issue, that might not be your first choice, but some people do find them flavorful, or if they're trying to quit soda, they enjoy the kombucha. It's another option. And then prebiotics are fiber. So you can eat these with the probiotic foods, but it's always great just to eat fiber in general, because it's what your body needs it's great for your colon, and it can flush things out of you, make your stool really thick of all the things that it needs to excrete. So when you think of fiber, that's the food that's feeding the probiotics. So think of carrots, radishes, oats, all these things that are on here, okay? So what's the deal with gluten, dairy, sugar? People ask about these all the time, and people tend to love them, and there's reasons why that happens. But they're inflammatory, so I'm going to get into each one of them. And they are inflammatory for all humans. So people react at different levels of it. Of course, there's levels that are more concerning, like celiac, where it's pretty life-threatening and you have to avoid the gluten. But the gluten is in fact inflammatory for everyone. But again, people react to it differently. And then food sensitivities versus leaky gut. I get this question all the time. What's the real issue? So if someone's showing up with a lot of food sensitivities, that's a sign that there is leaky gut going on. And you guys can see my hands here. So this is the way that the lining of the intestine should be, nice and tight junctions here. When you have something called leaky gut, it means that, and it comes from eating a lot of inflammatory foods is typically the culprit here. And these inflammatory foods create a lot of inflammation in the gut, obviously, and they tend to create pockets, and they puncture little holes through the gut lining. I'm trying to get a good angle here. So you see these little holes. So what happens then is that the proteins in these foods, so ideally you want this tight gap junction, so all the nutrients get absorbed into the bloodstream and help the body in the ways that they need to. And then what stays in this lining gets processed and then excreted out of the body. But then you have these proteins popping out. In gluten, it's gliadin, and it gets into the bloodstream, and it wreaks havoc on the body in all sorts of ways. So what's showing up on food sensitivities, the problem isn't the cauliflower you're eating, the broccoli you're eating. It tends to be foods that you do eat a lot. But over time, you treat that inflammation in the gut, you reverse the leaky gut situation that's going on, and then you can go back to eating your foods because you don't have that inflammation going on. The food is getting processed the way it needs to and helping you. So I hope that clears things up for you guys. We can talk about that in another webinar too. And so gluten inflammatory. So I have this picture of this gluten-free bread that I made. I like to post things I like to make fun food all the time. So this was a great recipe, and it was really tasty because sometimes you just want, you know, a good type of bread to eat if you're craving it, but you can make it on your own. So, and it's super easy to make, and it's really tasty. But gluten is inflammatory, and it is because gluten irritates the gut lining, and it's been overly processed over the years. So I know we've heard about this a lot. And it creates this toxic load, you know, and it puts a stress on the body. And I just talked about, you know, how the gluten, the protein in the wheat, what it does, and in aiding and for that systemic inflammation, which doesn't really benefit anybody. So that's the story with that guy there. And then dairy is also inflammatory. We're the only animals that consume milk after infancy for no good reason. It's not benefiting us. It benefits infants, and all the other animals know that. But after infancy, it doesn't. And what makes it worse then is poor nutrition for the cows, eating these overly processed grains, poor nutrition for humans. So it's really quite an issue. And then it causes, in Chinese medicine, dampness. So there's phlegm and mucus formation. A lot of people might have nasal congestion, the dampness in the body. You can have heaviness in the joints, even joint pain. And this dampness is a stress on the body, and it can cause inflammation. Shows sugar as well. People know about that. The crash and burn, and it's really addicting. Okay, so signs of inflammation. So inflammation is a normal process that we have in the body. Acute inflammation is healing for us. And these are also signs of acute, but when it's chronic and you're always having these feelings of heat, a rash, joint pain, fatigue, swelling, is it correlated with the food? Is chronic inflammation the root cause of your disease, possibly, causing all these other random symptoms going on? Go see a doctor and get your proper diagnosis of that and get that checked out. So the anti-inflammatory diet, this is how I reversed. I had my autoimmune condition, and the anti-inflammatory diet was my lifesaver here. I avoided the three main culprits we were already talking about, as well as nightshades. Nightshades have a component called solanaceae in them, and eggplants, peppers, tomato, and white potato were the culprits there. Sweet potato is okay, and black pepper spice is okay. I took those out of my diet. I also had some supplements, and using some other naturopathic modalities, and I reversed my ANA and I reversed my autoimmune condition. It was fantastic. Turmeric is a great spice also that could be anti-inflammatory for some people, but there are other, eating the rainbow, eating tons of greens, get tons of antioxidants and fiber in your diet, and you're on the road to getting all the nutrients that you need. So 6 essential nutrients. Essential means you need it from food. So good carbs, good fats, good proteins, minerals, vitamins, and water I'm going to talk about. So ask yourself when you're eating, is this food going to fuel me or just fill me? You want it to fuel you up and give you the energy you need. If you're not really hungry for it, then you're just filling up some void, and maybe there's another component there that you need to think about it with your relationships with food. But eating a variety of food helps you ingest and get all the vitamins and minerals your body needs. So these essential nutrients are what I'm going to be talking about, because you have to ingest them from food because the body requires it. It can't make it on its own. And this comes from a proper diet. Okay? So make half your plate fruits and veggies, and here's all the good macronutrients I'm going to talk about. So complex carbs. Carbs are your energy source. If you're feeling low fatigue and maybe you're doing diets that are limiting carbs, think about eating complex carbs. It's good fiber for you. It takes a while for the body to process and digest, so you're going to feel full and you're going to have the energy you need and the nutrition's in the food. And then avoid those simple carbs because the fibers are all removed from them, and it's just refined simple sugar molecules, and it lacks the nutrients and the body burns it really quickly. So the good fats are brain food. You need these guys. The omega-3 fatty acids, you need to get them from the foods that you eat. Avocados are one of my favorite staples there. Chia seeds, flax seeds, and then avoid the bad fats, those trans fats. And it can be really tricky because, on the packaged food, and you want to be careful with packaged food because it's been processed. And when you look at it, it might say on the front, no fat, But when you look in the back, if it even says trans fat 0, there could still be a trace amount of them, like 0.5 milligrams of them in it. So it can be really confusing. It gets really misleading with labels. So read the labels and understand that. Good protein. So amino acids, they're the building block of protein. So there are about 20 amino acids out there, about half of them. So 9 of them are essential, meaning we need to get them from food. So you really need to eat a variety of food to get these amino acids that are built, that give you the protein you need. And this is so important for neurotransmitters, for your hormones to function, enzymatic functioning as well, and to build and maintain any muscle tissue. So when you're working out, it's really important to have that. And serving size with protein, think of the size of your palm. The only thing, anyone having any renal dysfunction, you just want to eat smaller amounts of protein, but you can eat them more often. And, you know, beans, nuts, and seeds, great options for that. So I'm not going to read through all the foods on here, but you guys have access to this PowerPoint and you can reference them a lot. So fat-soluble vitamins are stored in fat tissue. So you never want to have too many of these because it could be toxic, and the water-soluble ones are easily excreted. So you definitely want to have a good diet to maintain a good amount of vitamin B's and vitamin C in your body. So, okay. And these are all here for you guys to reference. Some B vitamins, trace minerals. You need these in smaller amounts, but plenty of options to get them from food. Minerals here, you need them your body requires larger amounts of them. So you can reference that as well. And then water. So drinking at least half your weight in filtered water is really important for you because your body needs it. So it needs it in all the cells, organs, and the tissues. It helps to regulate the body temperature. And your body's constantly using it by being a human, breathing, sweating, and digesting. You're utilizing all the water. And if you do have dehydration, your body can give you some signals for it. You might be getting headaches, some dull headaches, possibly. It can affect your proper detox as well because you're not drinking the water, and you're not able to detox properly and get things flowing. And also you may be constipated, and drinking a little bit more water could be the answer that you need. And just read the labels. So you want to be able to pronounce all ingredients, avoid any labels that have more than 5 ingredients. And always remember that the ingredients are listed from the most amount of them in them to the least amount. And organic. With this, you look at the label there in the stickers in the produce section, when they're starts with a 9 and 5 digits long, it's organic. If they start with a 4 and 4 digits long, then it's not organic. So sometimes it gets mixed up, but that's the way you'll know. And then this is a great website to reference. And just try and do the best that you can, with all this information. So I know we have a few more minutes for questions. So we'll get into that. And then, okay, yes, we'll do the questions now, right?
Yeah.
Okay.
Thank you, Dr. Dawn. That was a lot to cover in a short and efficient amount of time. So that was great. We did have a few questions come in. So let's see the first one. So the first question coming in says, you talked a lot about inflammatory foods. What's your thought on coffee? Is that a beneficial food for people or drink, or is it something people should avoid in general?
So coffee really depends on the person. It depends how much you're drinking of it and how you're drinking it. So what you're adding to the coffee. If you're adding sugar to it, then it could definitely be causing an inflammatory issue. If you're asking the question, then it might not be the right thing for you because you kind of know if it's good for you or not. It can also affect mood. So sometimes if someone has anxiety and they get really jittery, the coffee could be setting that off. If you're feeling really hot from drinking it also, and you think that you might have an inflammatory issue, then it's probably not helping the inflammation. It could be causing that. And then but sometimes when people are depressed, coffee can help them. They feel like it's a little boost. But again, having just 1 cup a day is the key. Overdoing it, that could be the problem. So it really depends on how you're consuming it. So I hope that helps.
Yeah, that's great. Another question came in here. So the role of the anti-inflammatory diet, people seem to be reading a lot about that, but for some people it's kind of hard. And this person's worried about giving up tomatoes. Any thoughts on sort of picking and choosing the specific foods and maybe tomatoes in particular?
Yeah. Good question. The anti-inflammatory diet can be really restrictive for some people. In terms of with autoimmune conditions, it's best, I always advise patients to try, I give them the information about nightshades. And, if they're not able to try all of them, then try a few of them. And then you can attempt the other ones also. But if go for it and try, maybe just eat the tomatoes, cook the tomatoes. That could have a better effect on you. But, and what happens is that when you reverse the inflammation in your body, you might be able to eat these foods again. Or the answer is when you take these out of your diet and you're going to feel really great. So, be gentle on yourself. You can try one at a time. It really, depends on the person. And again, checking to see the state that you're in. If you react, and you can ask yourself the questions when you eat the foods, if you're having those symptoms of feeling hot, feeling joint pain, feeling the fatigue, you can think about maybe it might be related to that foods. And then when you switch that mindset with that food, you might not even end up craving it. So it's definitely something to play around and work with.
Great. And if you have questions, send them in. We have time for just a couple quick more questions. So this other question came in. It seems like there's a lot of craze around high fat or low fat foods, or high carb, low carb, and keto and paleo diets are pretty popular these days. Can you speak a little bit to, first of all, just the clinical value of doing those kinds of diets, but also sort of where you feel how people should decide whether they should do low fat, low carb, high carb, things like that?
Yeah. So definitely a big fan of having all three of those macronutrients that you need. Carbs are really important for energy metabolism in the body. Protein are those amino acids, affects neurotransmitters, mood, and then fats are your brain food as well. So it's important to have a balance of all of those. There are some instances where the keto diet, that high fat diet, can be really beneficial. And then also if you're trying that paleo diet, high protein diet, but it's not for the long term, but there are exceptions to it. So people with epilepsy, they do benefit from the keto diet, and there's studies to prove that. And then avoiding those carbs, over the long term, for them not having the seizures there, really benefits them over the long haul. And so for them, it can help diabetes also. So there's a variety of reasons as to why it might be good for them. But also you can consider just trying it for short term if you're trying to lose some weight and see if that helps. But consider it's really important to have those good carbs for the energy. So if you are trying those paleo or keto diets and feeling like you're fatigued, think about having the good complex carbs, because your body will need them too. So it's something if you are considering to do it for the short term, but it's definitely not, they aren't sustainable lifestyles unless you have certain medical conditions that do require, particularly the keto with that high fat. So I hope that helps.
Yeah, that's great. Thank you. So it sounds like just like anything else, Dr. Dawn, that's a clinical tool that we use. And say you mentioned diabetes, someone comes in with diabetes, maybe starting on keto is appropriate, but it's about the lifestyle changes they make being sustainable. And so maybe help them transition into something that fits into their lives better.
Yeah, absolutely.
Great. I've got one more question. This one's coming from me. How can people get a hold of you? I think part of the challenge with short webinars is we want to make sure to keep people's attention, but you couldn't cover everything you wanted to, and certainly you couldn't personalize for people on the call. So can you speak to how people can get a hold of you, set up an appointment or a consult to see if they're the right fit?
Sure. Actually, this would have been a good page to have up. You can follow me. So the website here is innersourcehealth.com. I'm in the Huntington office 4 days a week. And then I'm in the Manhattan office here once a week on Tuesdays. So you can also follow me on Instagram at Dr. Dawn ND, Dr. Dawn ND, and Facebook I'm at /Dr. Dawn ND as well. The phone number that you can always call in is 631-421-1848. So thanks for joining.
Great. Thank you, everyone. Keep an eye out for future Inner Source webinars, and we look forward to joining you on your health journey. Thanks.
Okay. think I stopped breathing.